Let's talk a little bit about navigating Medicare. I am Taylor Kaspar, owner and managing attorney of Legacy Estate Planning, where we help families leave a legacy that lasts. Medicare is a federal entitlement healthcare system that is designed for people over the age of 65. Of course, there's some exceptions to that, like if you're already categorized as a disabled individual and you're under 65, you may qualify for Medicare early. But typically, it's designed for people 65 and up. It's a federal entitlement that's tied to the Social Security system and the FICA taxes that we all pay. And it's to ensure that you have health care in your retirement and in your later years in life. Now, it's a great idea for a system, but it can be very difficult to understand and navigate all the ins and out of the Medicare system. There are four main parts to Medicare: Medicare A, B, C, and D. Medicare A is your hospitalization insurance. So this is the insurance that you use when you get sick and you need to be admitted to the hospital. You fall down and you have an injury and you get admitted. You need to do a temporary stay in a skilled nursing facility for transitional care, maybe from a surgery until you can go back home, or things of that nature. That's all Medicare Part A. Medicare Part A is traditional Medicare. That's what you're entitled to when you turn 65. It's the one that everybody gets, so long as they had enough credits on their earning record to qualify for Social Security, or able to qualify themselves for Social Security on the earning record of a spouse. If those things are true, then you get Medicare Part A. All you have to do is sign up and enroll for Medicare when your initial enrollment period comes around. Your initial enrollment period is linked to your age, so it opens 3 months before you turn 65. You can go ahead and start filling out that paperwork to get yourself enrolled in Medicare Part A. Medicare Part B is your day-to-day medical care insurance. That's your doctor's office visits and your preventative care and all the regular things that we do to keep ourselves healthy that we associate with a health insurance coverage. So Medicare Part B is something that has a premium attached to it. And the minimum premium for Medicare Part B in the year 2024 is $174 per month. That money comes right out of your Social Security check, and that's how you pay for Medicare Part B. Parts A and B are considered, again, your traditional Medicare coverage. This is the most common type of coverage that's available. Everybody's entitled to it so long as you are getting Social Security or eligible to do so. If you defer or delay your Social Security until you're age 72, you can still sign up, and you should sign up to get Medicare at age 65, even if you're still working, even if you're not taking your Social Security yet. The reason is because if you don't sign up at 65 and you miss it, you got to wait the whole another year to get into the general enrollment period that starts the following year. That would give you, coverage from January 1 of that next year forward. So that could be a mess for you if you retire or lose insurance in the middle of the year. The other reason you want to get enrolled right away is because if you don't enroll in Part B when you turn 65, there is a penalty assessed to you. So there's a penalty of 10% per year that you don't enroll in Medicare Part B. So instead of your premium being $174, you would add 10% the following year, $17.40, and you lost me on the math, but that would put you higher than if you just enrolled the first time, right? Unless you can prove continuity of coverage and all that. And let's not even get into that because that can sometimes be tricky and difficult to do. But that's basically what you need to know about Medicare's Part A and Part B on that surface level. Now, there's something called Medicare Part C. Part C is an optional program. This is your Medicare Advantage program. These are what you typically see TV commercials about, right? That Mutual of Omaha or whoever that run their TV commercials, and they talk about Medicare Advantage plans. And Medicare Advantage plans are a totally standalone type of Medicare coverage that you can get through a private company. So Medicare Advantage plans are something that came into the marketplace because there's, as you may have guessed it, some holes. and Medicare Parts A and B. I told you Medicare A covers hospitalization and B covers your regular day-to-day care, but there are limits to that coverage. There are co-insurances and deductibles and co-pays, and certain things are covered for 2 nights or 3 nights or 120 nights or however many nights, right? So things are covered for a limited duration of time that could leave you with a really high coinsurance once that duration of time has ended, where Medicare offers its coverage. Or certain types of things are covered, but not others. So then the system, the insurance companies, they saw all these holes in the system and they decided we can put together some private insurance options that would take advantage of the fact that, not take advantage in a bad way, but take advantage of the fact that there are holes in the system by providing different coverage that have a higher level of care, maybe a lower level of co-insurance, and we can bring these to market. And that's exactly what the insurance companies did. Now, the drawback sometimes to a Medicare C, Part C, or a Medicare Advantage program is, in order to ensure that they're not losing all their money and that these companies have some level of profitability, these companies have limited their networks, right? So you may get a Medicare Part C or a Medicare Advantage plan, but you will find that you only have coverage for these 5 doctors for this thing, because you have to stay in network. So some people don't like the fact that they have to stay in network, and they would just prefer to have Medicare Parts A and Parts B, and maybe they'll buy a different supplement or something like that. But there are lots of options in the marketplace and across the landscape when you're talking about if you want to just do Parts A and B, if you want to do Part C, or what you want to do. There is some flexibility to be able to be on Parts A and B, but then maybe decide later you want to have a Part C plan. But you can't just switch it whenever you want. You have to do that in the annual enrollment periods that are available to you, because we don't want people, the government or these companies don't want people getting sick and deciding, oh, now I'll take advantage of the fact that this is available to me and I'll flip it over. So you do have to wait to get into these programs or switch back and forth between programs for that general enrollment period that happens annually. The last part of Medicare is Part D, and that is your prescription drug coverage. That is also something that comes with a premium. You don't just automatically get Part D. As with all the parts, you have to sign up, and then Part D can have varying levels of coverage for what you're able to access through that part and through their programs and systems. So Part D has a premium to it, but if you know that you may need, or that you're already taking prescription drugs now, or you may need to take them in the future, it's not a bad idea to go ahead and sign up for Part D before you need it, because we know just even little things sometimes require prescription drug coverage. Like a trip to the urgent care that might be covered by Part B doesn't mean that the antibiotic prescribed to you or the medication prescribed to you is covered under Part B. You need your Part D to cover that. And so you want to make sure that you've rounded out all of your needs as you get ready to enroll in Medicare. So there are a lot of considerations for you when you're thinking about enrolling in and navigating this Medicare system. You want to be looking at what treatments are you already receiving? Do you have known healthcare conditions? And then you really need to look at the intersection of the plan and the coverage versus your budget. What's going to make the most sense? It might be awesome to only pay for Parts A and B with that $174 premium that comes right out of your Social Security check until you get sick, right? And then you're in a hospital longer than you want to be, or you need prescription drug coverage and you don't have it, or the co-insurance is really high and now you're coming out of pocket for all this money. So you really want to thoughtfully consider and look at what the co-insurances are for those parts, how many days you're covered for the hospital, and all the totality of it all before you rush out and make a decision based on, I only pay $174 now. A whole different system that we'll talk about at a later time is that of Medicaid, or medical assistance as we call it here in Minnesota. And specifically, we're talking about medical assistance for long-term care. So that may be living in a skilled nursing facility or somewhere where you receive care for possibly the rest of your life inside of a facility, or that could be where you receive home-based community home-based and community supports coming into your home for PCA services, homemaking services, and care to keep you in your home, but it's still long-term care. You wouldn't be able to maintain these functions and these things by yourself. So that's a totally different system for us to get into, and they don't cover the same thing. So there's yet another consideration as you navigate your health care and turning 65. Make sure if you got value from this video that you like this video and subscribe to this channel so you never miss new content from me. You can also pop down in the description and in the comments and download our free Medicare guide cheat sheet. Till next time.